In order to prepare you for your visit, please watch a short video which will explain how we are operating, what you can expect during your visits, and the systems we have put into place to keep you and our staff safe. We are taking extra precautions to keep you and our staff safe. Many of these precautions you will not see, as they will happen before you enter the surgery and after you leave. However, we are, along with our trained teams, going the extra mile to ensure safety by implementing extra infection control prevention procedures, extended training, and changing the way we operate as a dental practice.
You will notice some major changes to how your appointments are going to work. Firstly, you would have received either via the post or email all of the paperwork needed. We ask that you please complete this and email it back to us, or print it out, sign it and bring it with you and give it to the host once they welcome you to the practice. Secondly, we are taking all payments over the telephone. This alleviates the need for you to be in the practice longer than necessary. It also maintains social distancing and keeps the numbers in the practice to the bare minimum. Lastly, please don't expect any treatment to be done upon your first appointment. Treatment now needs to be thoroughly planned, and therefore we are unable to do treatment when you first present to us. After planning and risk assessing, we can then proceed with treatment. However, once you finish your appointment, you should leave the surgery and the practice will contact you with any follow-ups, any follow-up paperwork, and any future appointments that need to be booked. Normally, we take walk-in emergencies. However, to control the flow of patients, we will only be seeing people with a pre-booked appointment, either via the telephone or email. It is important before coming to the surgery that you use the toilet. Our toilets and our reception area will be closed. Also imperative is that you bring a face covering with you, either a mask or a scarf, as without these, you will be refused entry to the practice and we will have to reschedule your appointment. When arriving at the practice, it is important that you remain within your car or outside the main front door. Our reception teams will give you a call when we're ready to let you into the practice. Please arrive a few minutes early. This will allow enough time for us to be able to call you, and please make sure we have your up-to-date contact details. It is very important that you come to the surgery on your own. If you're coming with a child or you need to bring a carer, we will only allow one accompanying adult in the surgery at the same time. So unless you can come on your own or with only one person, we may have to reschedule your appointment.
Our reception team will call you when we are ready for you to enter the building, so please ensure you have given us your up-to-date telephone number. When at the door, please knock, and the door will be unlocked. A host dressed in PPE will ensure you have a face covering, and then we'll ask you to step back so we're able to take your temperature. If your temperature is too high, you will be asked to leave. Please go home and we will make a follow-up call to you with instructions. If your temperature is okay, our host will show you in and lock the door after you. Firstly, you will be asked to use our alcohol gel to sanitize your hands. After which, you can leave any coats or bags with us. These would be stored either in a plastic box inside the surgery or in a dedicated non-clinical area. It is important that you do not bring any valuables with you to the surgery. Once you have removed your coats and bags, please keep your face covering on and you will be shown directly into the treatment room. Please do not be alarmed, as the dentist and the dental assistant will be in heightened PPE. You will be directed to wash your hands. Please wash your hands for a minimum of 20 seconds, turning the tap off with your elbow. You will then be asked and directed to take a seat. It is important that you keep your face mask on until you have been asked to remove it. It is important to remember that you will need to allow extra time for your appointment. This is due to the precautions we are taking. We have reduced our practice capacity and are running at less than a third of capacity, allowing us time to make you safer. So please remember, your appointment will take longer than it usually does. Before we start, you may be asked to rinse your mouth with a special mouthwash and spit into a separate cup. This will be disposed of correctly by our dental assistants. Thereafter, the session will take place as normal. To ensure your safety, we have special air purification units running in the practice. This helps clear out any aerosols from the air. Along with this, we are using a fogger. This device sprays the whole room with antibacterial solution. We allow this solution to settle, killing any bacteria in the surgery. As always, the instruments used in your session will be individually wrapped. Please remember, only take your face covering off once you have been instructed to by the dentist. Once we finish your session, you'll be asked to replace your face covering. You will then be invited to wash your hands once again, turning the tap off with your elbow. From here, you will be shown out of the treatment room to collect your coats and bags. Our host will then instruct you as to the next steps of your treatment. If you need to return, we will be making an appointment over the telephone, and the paperwork will be emailed to you as it was before your first session. From here, the team will be cleaning all surfaces, including the plastic box, door handles, taps, sinks, chairs, floors, etc. Changing PPE and switching to a new treatment room, allowing the one that you were seen in to air and purify. Once the whole process has been complete, we will be able and in a position to call the next patient waiting outside or in their car, and the whole process will start again.